Hi, I'm Dave Bloom, CEO of SnackSafely.com. If you're a follower of our blog, you know we often report on the emergency epinephrine market. And we have our eye on a class of new devices that are needle-free. Now, why is this important? Needle-free epinephrine is very important because there are many in the community that have a fear of the needle that's employed in your traditional auto-injector. So that fear often leads them to hesitate to use the epinephrine, and as you know, hesitation leads to poorer outcomes. So we want people to administer epinephrine as soon as they suspect anaphylaxis, and a needle-free alternative would be a boon for many of those folks. Now, we thought we would have a needle-free alternative back in September. A company called ARS Pharmaceuticals had their device, which is called neffy, and they submitted it to the FDA, and the FDA gave all indications that they would approve the device in September. Now, what makes neffy so special? Rather than jabbing yourself in the thigh, you take the small neffy device and you spray it into one nostril. So it eliminates the fear entirely of the needle. So what happened? As I said, we fully expected the FDA to approve the device. Come September, at the last moment, they denied approval and sent ARS Pharma back to the drawing board. They said, we need more tests, we need more data, come back when you have those. So back in May, ARS Pharma came back to the FDA, provided them the additional testing results that they requested, and since then, we've heard nothing. The FDA could have and should have been able to approve the device quickly because they had all the analysis they did last year, but for some reason they're silent and we haven't heard anything about approval. In the meantime, ARS Pharma presented that same data to the European equivalent of the FDA. It's called the EMA. And the EMA analyzed the data, and they have indicated that they're going to approve neffy for the European market. So what about the American market? We don't know. We haven't heard anything from the FDA indicating that they're going to approve it soon. And approval is not 100% assured. So we're in this gray zone. What we need to do is come together as a community and pressure the FDA to do what's right and approve neffy. Now, how do we do that? We have two ways of doing that. One is we need you to email the FDA, and we need you to tell them we desperately need this device to be approved. So what we've done is at the end of this video, you will see a link, and that link will pop up your email app filled in with the appropriate address as well as subject, and we request that you please put in your comments, put in your own rationale for why neffy needs to be approved, and send that off to the FDA. Hopefully, with the entire community responding, they'll get the message. The other way is you can sign our petition. So back in January, we floated a petition demanding that the FDA approve neffy. And since then, it's garnered over 40,000 signatures. For those who have signed already, I truly appreciate it. For you others who haven't signed it yet, please follow the link also at the end of this video and sign the petition. After some time, what we're going to do is we're going to print all 40,000 plus signatures to that petition, and we're going to send it to the appropriate people at the FDA, letting them know that we need this device approved and that we're watching them and that we expect them to do the right thing. Now, there's no reason for this device not to be approved. It's been tested 6 ways to Sunday. It's as effective and as fast acting as the traditional auto-injector. This would be a tremendous boon for the food allergy community, because not only would it provide a needle-free option, as we discussed before, but it's also another entrant into the market, and with more players in the market, that would hopefully drive the cost of epinephrine, emergency epinephrine devices down. So please consider acting on those two specific requests. Thank you so much for your time. As I mentioned, I'm Dave Bloom, the CEO of SnackSafely.com. If you're a follower of ours, terrific. If not, we cover all things food allergy, including auto-injectors and emergency epinephrine devices, food products, studies, and research into therapies and a cure. So if you're not a follower, come follow us. Thanks so much. Bye-bye.